Hi everybody, I am Dr. Shehla Shaikh, consultant endocrinologist from Mumbai. It's an absolute pleasure being over here at RSSDI 2018. It was a pleasure to be speaking about ectopic fat and the risk of diabetes, which I think is a very pertinent topic in present times. The reason it is pertinent is because we all know that obesity is increasingly associated with diabetes, and with increasing obesity we are facing a very big epidemic of diabetes in our country. The sad part of it all is that we do not realize to a great extent that this is because of the lifestyle that we are leading, and to a very great extent we would be able to reduce the contribution that ectopic fat is doing to this entire process of inflammation if we can lead healthier lifestyles in every way possible. Ectopic fat by definition is triglyceride deposition in areas where conventionally you do not have fat deposition, like for example the liver, the muscle, sometimes it can be around the kidneys. Now we are increasingly talking in terms of epicardial fat and the risk of cardiovascular disorders. We are also talking about fat around vessels, and also now we are talking about fat in the neck. So whenever there is fat which is present in areas where it is not supposed to be, for example 80% of the fat is supposed to be in the subcutaneous adipose tissue, but the rest of the fat, when the subcutaneous adipose tissue gets overwhelmed by the excess calories that you and me are increasingly consuming in modern day living, this fat gets deposited in ectopic areas, and this actually is the metabolically bad fat. When I say the metabolically bad fat, what I mean to tell you is that this is the fat which then contributes to inflammation. This is the fat which is also going to cause endoplasmic reticulum dysfunction, is going to cause the release of a number of adipokines. It is going to cause a lot of inflammation in the system, which then contributes to a lot of morbidity, which is going to contribute to pre-diabetes and subsequently to diabetes. Not only in adults, we should be stepping back a little and also looking after our children and adolescents better to reduce the incidence of obesity in them, because now we have enough evidence that it is the increased amount of visceral adipose tissue, it is the increased amount of peripancreatic fat and pancreatic fat and hepatic fat, which is actually contributing in a very big way to the pre-diabetes and diabetes epidemic that we are seeing. The very good part about treatment is that yes, it is easy, this fat can be treated in a very easy manner with proper lifestyle. If you realize that when we talk conventionally in terms of 5 to 10% of weight reduction, that simple 5 to 10% of weight reduction actually translates into almost a 30% reduction of hepatic fat. A simple 10% reduction of weight translates to almost a 50% reduction of hepatic fat. And we need to keep this in mind that if you follow a healthier lifestyle, if you follow a lifestyle, you take care of the amount of calories you are consuming, you try to put in some kind of activity every day, you try to incorporate a healthier lifestyle with your children, I think it goes a long way in preventing this epidemic that you and me are facing.